Welcome back to H360 Health Talk. We're here back with Gary Mulligan, the founder and CEO of Goals in Motion Physical Therapy and Wellness. Gary, thanks for joining me.
Thanks so much for having me, Dave.
So when somebody walks in for the first time, the assessment begins. When I walked in the first time, was the first thing that came to your mind train wreck?
Yes,
It was. So I spent months with you, both with my knee and my rotator cuff, and on the tail end of my hip. How do you gear somebody's expectations, right? So I would imagine, especially athletes, you get a lot of type A personalities walking through the door,
Yeah.
right? And so how do you, when you sit them down for the first time, you say, look, this is a marathon, it's not a sprint. And how do you, after gauging somebody and seeing where they're at and how long in your mind you think it realistically is going to take, how do you set that bar?
Yeah, I mean, that's definitely a tough bar to set because some people do come in with the expectation as I'm already going to be fixed. Today's day one, you're going to fix me. I'm going to be able to go and do what I want to do. That's not always the case. And even if you come in and you're feeling great after the first visit, sometimes after the second visit, if we add something new and challenge you in a new way, sometimes you do feel like you got hit by a train, right? It all depends. And not everybody's going to be better each visit. There are people who get better and then all of a sudden they feel worse, but then they bounce back up, right? So it's not always a straight line ride. It's tough because there are people who come in and they're expecting, all right, well, you're just going to give me a couple exercises. I'll go do them at home. And then, in 3 months, I'll be fine, right? And it's probably not the case because if I give you exercises today versus 3 months from now, it's going to be different exercises. We're going to try to progress that as you go, but I'm not going to give you the hardest things possible day one because that might be too much for you. And then that's going to beat you down emotionally. And you're going to be like, well, I can't do this. Physical therapy doesn't work. Mm-hmm. Well, it's not the physical therapy that doesn't work. It just wasn't the right time to give you that stuff. And that happens in general, patient to physical therapists. You and I meshed pretty well, but if our personalities were different, maybe we wouldn't mesh well. And then you might say, well, physical therapy doesn't work. No, it's just that I wasn't the right clinician for you. You have to go and find the right clinician. You're not going to go to a cardiologist and say, well, cardiology doesn't work, right? You might go to a different one and see how they work compared to the other one that you didn't like as much, or you didn't think he was doing the right thing for you.
It really, it does have to be a partnership. So thinking back, let's talk about my shoulder surgery, for example. So take us through, I walk in the door, I have the surgery, we talked about the surgery. I think you knew it was going to be a little tougher than I personally thought it was going to be. I figured, well, since I got through the hip and, this rotator cuff is going to be kind of light duty for me, and it really wasn't. And so take us through the program that, when I walked in, you kind of put me on.
Yeah, well, I mean, initially after shoulder surgery like that, it's normally just range of motion in the beginning, right? Which got boring really fast because you're a go guy, right? So you don't want to just do those exercises where it's, all right, I'm moving my arm around, right? Or the pendulums where you're leaning over and you're using your body weight to move your arm.
I remember, yeah, yeah.
But once you start, and that's the buy-in, is trying to get you on board to say like, well, let's not screw everything up. You went through a surgery for a reason. So you go nice, slow, progress it as you need to. And then finally you get to advance, right? So first goal is always range of motion, get you where you need to be, and then strengthening. And normally once a rotator cuff's involved, you're not going to strengthen for about the first 8 weeks. So sometimes when you have range of motion, like you gained range of motion pretty quickly, so it got boring really fast. But you're able to kind of go around it and work on it in different ways. And that's where creativity has to come in. Everybody's not going to be cookie cutter, right? So your shoulder surgery versus Joe Schmo's shoulder surgery is going to be totally different, even though you might have the same surgeon, you might have the same past medical history, you might be the same age and the same weight and everything, right? But it's still going to be different because your experiences through life is different than his. Your shoulder's been through different things than his has, right? So it's always going to be custom made for the patient, and that's what it should be.
So Gary, you recently decided to launch the Goals goals in motion, physical therapy, and wellness. Tell me what the philosophy of your new company is, how you work with patients. Where are you taking this company, and what can we expect to see from that?
Yeah, so the goal with this is just to be able to cater more to the patient and basically spend the entire session one-on-one, physical therapist and patient, and take everything else out of the picture. So I don't want the insurance company to be telling me that you can't come in more than 10 visits for a calendar year, right? I don't want there to be other barriers involved. I want it to be one-on-one. I'm showing you how to do the exercises. If you're doing an exercise and you're struggling with it, we could always break it down, get back on the table, make it easier because I have the time there with you. So that's really the main focus of this, is individualizing the whole treatment based on the patient and taking out those other factors and trying to make it one-on-one and make sure you get the care that you deserve and the care that you want.
So will there be certain types of patients that you're going to have in your practice? Are you going for the younger, middle age, older, or will it be a full range?
Yeah, I mean, it definitely could be a range because I've worked with all the ranges. Young athletes like gymnasts versus some collegiate athletes. And then obviously I've worked with the weekend warriors, right? So people who are doing yoga on Sundays.
Yeah. Yeah.
So there's no like set, I'm only going to work with this population or I'm not going to work with this population, right? It's kind of open and variable.
Now, are you taking certain measurements along the way? We talk about range of motion, we talk about strength training, um, dexterity. Are you there's there's got to be more than just your eye of watching somebody. There's got to be some measurement method here. How do you assess somebody's readiness to move to the next level?
So we end up using different tools to measure. We use goniometers, which is just basically measuring the range of motion, degrees in your joint range of motion, right? So I want to see where you are compared to normal, and use normal in quotes, right? Because your left side is going to be your normal side and then versus your right side, right? Or vice versa. Or to measure grip strength, we use dynamometers. So you're going to squeeze, it's going to tell me how many pounds of pressure you're able to put through. And then I'm going to check the other side, right? So your dominant hand is probably going to be a little bit stronger than your non-dominant side. But using things like that is how we go. And then there's other tools, right? So for the older patients, there's something called a tug, a timed up and go test. So we're having them get up out of a chair, walk a distance, come back and sit down in the chair, and we're timing that, because there's certain measures that tell me you're in the normal range for your age range, right? So that's going to tell me if you're at risk for a fall, and different things like that.
So I know that when I was going through my sessions, you're a proponent of ice and heat therapy as well. It's not just lifting and stretching. What role does that play into the whole physical therapy session?
Yeah, so heat normally before, because you want to loosen up and get some blood to the area, and then ice typically afterwards, but that's more, to calm everything down after we've been doing stuff. Some people don't respond well to ice or heat, right? So then I'm going to change it. I'm going to take it out. I'm not going to force them to sit there with ice on when they're tensing up the whole time because they're cold. They might either get heat at the end of the session or they may leave with nothing. And it's always based off feedback. So if you come back and you tell me, I felt terrible after the ice, I'm not going to put the ice on you again, right? We're going to experiment and we're going to do it without the ice. And if you leave and you tell me I felt like $1 million after we worked and I didn't have the ice, then we're not going to put the ice on again. So it's always going to be that individualized, certain people aren't going to respond. There's certain things like Raynaud's where people don't get great circulation in the cold. So I'm not going to put ice on somebody like that.
Yeah.
It's always going to be that little give and take, and you come back and you're giving me that feedback, and I'm taking that feedback and using it to help you in your recovery.
So as we grow older, are there things that you recommend people do just as preventative measures, let's say, especially somebody that's you go from middle age to beyond, the wear and tear on joints and muscles over the years just play a significant role in getting older. Are there some things that we can do before we get to that point to better ensure as we get older it will be hopefully a little better?
Yeah, absolutely. I'm a big proponent of movement, right? So any type of movement practice is going to help out. So whether that's, yoga, Pilates, Tai Chi. Tai Chi is great for people with balance issues. So when you're not taking those breaks and you're not moving throughout the day, you're going to get stiffer. And then all of a sudden you go and you say, I want to throw a football around with my son. But you've been here the whole time. And then when you go to throw and turn, all of a sudden your shoulder hurts because your body's not used to that. And it's going to perceive that motion as a threat because it just hasn't done that in the last 10 years.
So that's a good point. People that sit behind desks, have a desk job, I now see, advertised these stand-up desks, or now you can even put it on your desktop and you can raise it and you can stand. Is that something that is beneficial?
It could be, but in the end, if you're sitting for 8 to 10 hours a day without moving, or standing for 8 to 10 hours a day without moving, it's the same thing, right? It's not enough motion there. So your body gets used to being upright and standing, but then when you go to sit down in the car or on the train to commute home, and then all of a sudden you're realizing that your back's hurting you, it's because you were standing all day.
But even things like just standing up, touching your toes, or reaching for the ceiling and getting a stretch in is beneficial, I would imagine.
Oh, absolutely. Yeah. Simple things like that without even realizing, when you wake up sometimes, right, the first thing you do is you just throw your arms up over your head and it feels good.
Yeah.
And it's like an active stretch. You're using all those muscles. Even just animals, you see a dog or a cat get up after a nap and the first thing they do is kind of push themselves up, and it's because they're using those muscles that have been dormant while they've been laying down.
Downward dog.
Yeah, downward dog.
They're ready for that.
As long as you could get back up after that.
Well,
you're good.
that is the trick, right? There, is getting back up and walking out after the class is done.
Yeah.
Tell me, how does clothing, or I'm interested in hearing about shoes. When you see somebody come in and their gait is a little off, and they've got sneakers that look like they've been about 20 years old, and they're loosely tied and slipping around. Does that play a role in how well they're going to do, or not in physical therapy?
Maybe not so much how well they're going to do, but it definitely gives me a little bit more information, and I'm going to look into that more. So I always look at people's shoes, especially if they come in and the shoes are worn, that's perfect. Because I could look at them and see, well, this right one is worn way more than this left one.
Right.
So there's something going on here that they're putting more weight and pressure on the outside of that right foot. And I have to figure it out. Right. So any little piece that helps me put that puzzle together is always going to be beneficial to me. So versus sometimes you get people who come in with brand new shoes and I'm like, well, these are great, but I need to know what your shoes look like after wear.
Sure.
Or somebody comes in and they look like really worn shoes, and I ask them when they got them, and they say 3 months ago, and I'm thinking, wow, there's a lot of wear on the tread here. Where's it coming from?
Gary, thanks so much for joining me today. I look forward to seeing you again in the future, and I'd like to thank you for tuning in today.
Thanks so much, Dave.